I actually have a little experience now of Omicron as well. After 2 years of giving it the run, I was sick for the last 10 days, but I'm fine now. It wasn't mild, but I'm just one person. Anyway, so that's not moot to this point over here. I want to go across to Dr. Mehrotra, sir, and let's talk about the UP numbers. 11 of 75 districts, so 15%, not a very high number of districts above the positivity rate. But could that be because the actual testing is lower in Uttar Pradesh? Dr. Mehrotra?
Of course it's low, but one point I would like to say is, hell would have not broken loose if the election would have been postponed by a month or so by Election Commission. We are lucky that this mutant or this variant is not that virulent, though transmissibility is very high. So we are lucky in that. Still, we have seen in our clinical practice, all the patients who are being admitted for COVID are not only clinically, by clinical judgment, they are not only Omicron. Few patients have shown the sign of Delta. They have clear-cut picture in their CT which was sensitive of Delta. So, in my opinion, all the patients, elderly patients, especially with comorbid conditions, immunocompromised conditions, should take precaution. One thing
but then Dr. Mehrotra, the key question is this: we are going into elections. We're going to see the first phase in Uttar Pradesh not too far away. In a situation like this, do you believe that the Election Commission should continue with restrictions on campaigning in the run-up to the polls?
At least they should do one thing. They should allow the person who have got the immunization done to be allowed to participate in this activity. This should be taken care of. All the person, especially elderly person, especially person with comorbid condition, should not be allowed, and they by themselves should take precautions regarding that. And the one more positive point which I have in my mind that I would like to share, because we have a very high natural immunity because of the high spread of Delta in earlier wave. So chances of getting severe thing is less, but still for comorbid condition persons and require utmost care.
Sure. Dr. Laharia, your thoughts on this? We have political leaders going from house to house. In many cases, people use masks. In many cases, most cases, they don't. We have massive election rallies. We've seen in the Delta wave how tragic that was. Do we not need to learn from the past? Do our political leaders not need to cut down on this? Because, just saying that, oh, it's very mild, it'll all go away. The fact of the matter is people will still fall sick, right? And, we assume in this country that comorbidities are above 60. In fact, anybody can have a comorbidity. And they do in our country.
So I completely agree that these elections, the upcoming elections, cannot be held in a way that there is no pandemic. So there had to be restrictions and measures to reduce the transmission. But having said that, I also don't think there is any urgent need to postpone the election.
Okay.
Only reason, the point when one can say that to postpone election, if someone can come up with the answer that would be the time when election can be held safely. And we know that while pandemic would be over, the SARS-CoV-2 is not going anywhere. So number of new COVID-19 cases would continue to be reported. I quickly want to bring in the analogy of school closure. Around July 2021, we were hearing that, okay, wait for 1 month or 2 months and then school can be open.
Right.
And then we now know that it's around 6 or 8 months since school have been closed, open for only few days. Similarly, the elections, nobody can say with guarantee that when the SARS-CoV-2 transmission would be low level, which would be safe for elections. So in that sense, elections are essentials in the democracy. Elections should be held, but with the measures and restrictions.
Sure.
And Election Commission.
All right, so let's hope that the restrictions do continue. I'm sorry, doctors, I'm out of time on this. I need to wrap this up because I need to move to something which is related to Omicron. And after weeks, there's great news in Maharashtra where schools have started reopening. The question is the worst of Omicron